Welcome. This presentation is on an evidence-based program and prediabetes progression in a single-blind study. My name is Krista Corriatelli, and I am from the University of New England. As you can see, there was no conflicts of interest or external funding disclosed in the making of this study. Okay, so a little bit of background information to our objectives. So prediabetes is a condition where a person's cells do not respond normally to insulin, but their HbA1c is not high enough to be classified as type 2 diabetes, which is between 5.7 to 6.4. The image on the right asks the question, who is at risk for prediabetes? Well, ultimately, just about everyone. Anyone can be, at least. Currently, 1 in 3 American adults are pre-diabetic, and 90% of these people don't realize it. The dangers of remaining in a pre-diabetic state include the progression to type 2 diabetes, which is the 7th leading cause of death and is currently affecting 78 million adults in the United States. It also increases the risk of damage to organs and increases health complications such as high blood pressure and cardiovascular risks, and developing other non-communicable diseases like obesity. So we're going to look at how to reduce the risks. Some other risk factors are, for prediabetes, include being overweight or obese, being 45 years and older, being of an ethnicity or living in a poverty-stricken area, or poor diet. We're going to focus on the dietary choices, mainly because the intervention focuses on dietary and lifestyle choices. These dietary and lifestyle choices may increase the risk of diseases like prediabetes and obesity. So, fortunately, prediabetes can be prevented through treatments such as lifestyle changes, programs like the Evidence-Based National Diabetes Prevention Program. They have been researched and designed to help people identify and make changes that will work best for them in order to help prevent or reduce the risk of diabetes. So we have on here our objectives. The objective of the study is to evaluate the effects of an evidence-based CDC-recognized diabetes prevention program as an intervention in achieving 5 to 7% weight loss and a reduction of HbA1c to 5.7 or lower in adults ages 45 years and older who have prediabetes. The secondary objective is to identify the parameters of the successful studies for future research and development of evidence-based interventions that will help prevent or reduce the risk of prediabetes or type 2 diabetes in adults. As you can see, the image on the left kind of depicts a questions and answers here. We're asking some very important questions, and we're going to get on to the answers, or at least how we're going to answer these questions, hopefully, with the intervention and the study, the way it's going to be set up. For this study specifically, the PIO question, instead of your normal PICO question, is how does an evidence-based prediabetes prevention program affect weight loss and HbA1c in adults ages 45 years and older? And we gave the 5.7% and the 5.7 in HbA1c just a second ago, and we're looking at the population of adults. So to get this population of adults, we're going to show you a little logo here and on to our answers. The National Diabetes Prevention Program, as I mentioned, is the intervention. It is a lifestyle education program that covers the topics including being active, balancing calories, and maintaining progress. This program is currently offered at the Mingham Memorial Hospital, where the study will be conducted, and this is going to be an in-person intervention that is conducted by the hospital and their trained staff. And they've been giving this for years, so it's going to be very, very well done as far as the intervention part goes, because they've been doing it and they've been seeing success. Participants will attend the entirety of the in-person intervention and maintain their progress in order to complete or consider the study successful. Let's see here. They will be eligible if they have a body mass index or BMI of 24 or higher, have prediabetes or are at risk for developing type 2 diabetes as diagnosed by a minimum of HbA1c to between 5.7 and 6.4%. And if they are 45 years and older, they have to be able to travel to the program location. Most people in Idaho do travel, so it shouldn't be a problem. Diagnosis will be done by hospital staff, and if there's a question as of the diagnosis or prediabetes or type 2 diabetes, their primary care physician at the hospital will determine if they qualify for the study. They will be the ultimate deciding factor. Okay. Moving on, any participant who meets the defined HbA1c blood level will be eligible for pre-enrollment in the study. As you can see, there will be 80 participants in the group, and they'll be randomized either into the intervention or control, as an HbA1c blood draw will take place before enrollment to the study at enrollment at 6 months and 12 months, so they will have plenty of measurements. At the beginning of the study, there will be a 48 dietary recall to help provide the interviewers and the people giving the program a little insight into their normal dietary habits. Upon enrollment, all surveys and educational tools will be automatically included in the Lifestyle Change Educational Program. They will be kept separate from the normal program participants' files. They will be randomly assigned either into the experimental or the controlled group. As indicated by the picture on the left, once the data is collected, a de-identified process will be used to protect all the patient's information, including their ages and body mass indexes. This process will be used to blind the education staff who will provide the intervention and the hospital staff who will perform all the blood work and biometric collection. The researchers will not be blinded, and they will handle randomization, storage, and disposal of the information. This will be a single blind study with random assignment into the intervention group as noted, and you can see here the green is the intervention group. They will begin first, and they will go for 16 weeks and then finish out for 12 or to complete the year program out here at 12 months. Right here at the end of this, and then as soon as they complete the main intervention group, the control will start the second half of the intervention group, and they will actually run the exact same program, so there won't be any issues with health or delay of disease progress or disease resolvement, because they're going to get the exact same treatment as the intervention, just a little bit later, and they'll be on standard care up to that point. That's why you get a little blue line here. Okay, so it's at this time the control group will be taking off their usual care, and so they'll have usual care for the first little bit, and then they'll be entered in and then allowed to finish the program as they see fit. Okay, so the results of the study, there's going to be an HbA1c of 5.7 or lower and a weight loss of 5 to 7% are expected. Second-hand outcomes will be determined by the Framingham Diabetes Risk Score. They will also include the percentage of males, females, weight, HbA1c at enrollment, 6 months and 1 year. If the results follow previous research, then there should be a significant reduction in both body weight and HbA1c in the intervention over the control group, and the Framingham score will indicate if we've reduced the risk. The retention is expected around 70%, and as the science says, small changes can lead to big results. Okay. So for the conclusion, what we're expecting is to see a significant reduction in weight and a change into the lifestyle change program. Current research has evaluated the impact of differing methods, frameworks, and progression and use of these programs to reduce these specific levels. In the literature review, they have many studies that have shown, the literature review showed many studies the people who participate in these programs have helped reduce or prevent prediabetes. Ultimately expected that this program will provide the significant weight, and as you can see over here, we're going to achieve success in the successful lifestyle change. And onto our references. As you can see here, right here, and there. Thank you all for listening and participating, and this has been a great discussion. And any questions?